child development in developing countries too. The aim is to review psychological and biological risk factors that compromise child development. Biological factors that compromise development of young children are nutrients deficiency, infectious disease, environmental toxins, prenatal and postnatal growth. Psychological factors include parenting factors, maternal depression and exposure to violence. Risk factors, we got 4 of them: iron deficiency anemia, iodine deficiency, stunted growth, and inadequate cognitive stimulation. And poverty and socio-cultural determinants increase young children's exposure to risk factors. Poverty to child development pathways, you look at it, there's got social cultural factors include low maternal education, reduced access to services, and gender inequity, leading to biological factors listed above. As we all see on the pathway that both biological and psychosocial risk factors affect the cognitive development and function, leading to sensory cognition and social impairment in child development. Relationship between social disparity and healthcare. Maternal education. Low levels of maternal education may expose offspring to inadequate dietary intake, thereby causing iodine and iron deficiency to children who later become less active, less happy, and less cooperative and less attentive. Infectious disease. Diarrheal disease and conditions like malaria, meningitis, otitis media associated with poor language performance, behavioral, neurological, and cognitive impairments on children. Environmental exposure. Drinking of lead and arsenic contaminated water from wells may lead to intellectual deficits, motor, visual, motor, and behavioral development. Maternal depression. Children born from depressed mothers may have reduced cognitive function and higher levels of behavior, and this is due to the fact that the depressed mothers get less involved, less sensitive, and more negative when interacting with infants. Evaluation of research. The research process was well designed and the sample was the representative of the study population. The research was relatively easy to analyze with the use of tables and pathways to explain on studies done on different countries. The data was consistent, precise, and reliable with the use of graphs, charts, and diagrams, with the evidence obtained on 4 risk factors clear to warrant urgent attention. Structural factors determine how social disparities are produced and can be analyzed. So the research looked at 4 risk factors, analyzed prevalence in developing countries, summary of evidence using randomized interventional studies, and estimated effect sizes prove beyond doubt that there is existing evidence strong enough to warrant implementation of strategies that can reduce or prevent the effect of the risk, thereby increasing social, emotional, and cognitive incompetency in young children. Summary: as health professionals, on maternal education, there's more education campaigns, videos, audios, and pamphlets to sensitize the mothers the importance of antenatal and postnatal care, and also use of iron supplements. There is need for the government to build healthcare centers with accessible and provision of trained staff. Health promotion needs this need of resuscitation of the nutritional gardens, also looking on the cultural aspect of the population. Clean water, provision of safe drinking water from protected wells, free from arsenic and lead. That's like drilling of bores and testing of water resources to make sure they are free from these metals. Building of toilets as well, and health educational hygiene. Mothers and children will also need food supplement, rich in nutrients, and this with the help of the government and non-governmental organizations may help mothers from having fetal intrauterine restriction and the children from having malnutrition as well. All these need collaborative approach with other organizations like GO and voluntary organizations to increase capacity in addressing the disparities mentioned. And there's also need for advocacy to be increased.